Professor Coimbra, can this Apnoetest be lethal for the potential donor?
Yes. First of all, I would like to make crystal clear that several patients that are now currently selected for the diagnosis of brain death, they could be recovered to a normal daily life if they were not submitted to Apnoetest and they were given timely, updated, proper treatment. So this is something very important, and I would like to make that crystal clear. In other words, by performing those tests for brain death, those so-called diagnostic tests for brain death, we are killing patients to make sure that they are dead, which is nonsense. So this is the first statement that I would like to make crystal clear, as I said. And why am I saying that? We have to go back to 1968 when brain death, the concept of brain death, was introduced into medical practice. Back to 1968, physicians, medical doctors used to think that when we had no detectable neurological functions which is performed by the brain, the only possible explanation would be irreversible intracranial circulatory arrest. And why would this circulatory arrest occur? The reason why there is a lack of brain circulation in a patient who is a victim of brain trauma, head trauma, is because after the injury, the brain begins to swollen. And as the volume of the brain increases, the pressure into the skull increases too. So that as time goes by, the intracranial vessels that are supplying blood to the brain are compressed by this increased pressure. And back in 1968, we used to think that when all those so-called cephalic reflexes were like pupillary reflex to light, for example, when all those reflexes were no longer detectable, the only possible explanation is that the intracranial pressure had reached maximal values. That means that the blood vessels within the intracranial cavity were completely compressed, and there were no blood flow to the brain. So they associated lack of function to necrosis, to irreversible damage to the brain tissue. Lack of function, no vitality. Okay? That's the concept, the pathophysiological concept that was proposed in 1968 to select the criteria to diagnose brain death. Okay, but later on, the progress of medical science demonstrated that when the blood flow is decreased to only half the normal level, those reflexes can no longer be detected, but the brain is still recoverable at this point. within the range of 20 to 50% of brain blood flow, of the normal brain blood flow, the brain is functionally silent, but it's still recoverable. Okay, if you induce the apnea test, that means that you stop mechanical ventilation in order to increase the carbon dioxide concentration in the blood. When you do that, you cause what we call in medicine a sudden respiratory acidosis. And that means that there will be a negative effect on the strength of heartbeats. In other words, the patient will develop hypotension, and this is known to occur in up to 40% of patients that are submitted to apnea test. If you induce hypertension, you will decrease the blood circulation. And if the patient was having blood levels to the brain within that range of 20 to 50% of the normal level, and you decrease the blood pressure, the blood flow will go down to the range of below the level of 20%, and that means that you can induce irreversible brain damage by performing the apnea test. In addition to that, if you are decreasing the blood flow to the brain, you are also decreasing the blood flow to the respiratory centers. Those centers are the structures that you are testing when you do the apnea test. You want to know whether the brainstem, the respiratory centers in the brainstem, will respond to increases in carbon dioxide concentrations. But if you decrease the blood pressure, you will be decreasing the blood flow to respiratory centers, and the respiratory center will not respond to apnea test. And you can damage the respiratory centers irreversibly. You can irreversibly damage the respiratory centers by inducing apnea in these patients. It should be clear that the apnea test may last up to 10 minutes. A patient can be without proper respiration, mechanical respiration for up to 10 minutes. And this may kill the patient. And that's why I'm saying that when we are testing those patients for brain death, we are killing them. We are killing an unknown number of those patients. Some of those patients may have irreversible brain damage prior to those tests, but a large number of them may be recoverable up to that point. And when you induce a apnea test in those patients that up to that point could be recovered, they are no longer recovered. Nearly all of those patients are having decreased production of thyroid hormones, because the signal that comes from the brain in order to stimulate the thyroid gland to produce thyroid hormones, this signal is decreased as the blood flow is not normal to the range of so-called ischemic penumbra, which is insufficient to cause irreversible damage. If the blood flow is at that level, you will have decreased the levels of the hormone that stimulates the thyroid gland to produce its own hormones. That is a condition called hypothyroidism. And if you have decreased production of thyroid hormones, the respiratory centers will not respond to apnea test. That's the second reason why the respiratory centers cannot respond to apnea tests. So those patients are not receiving proper, updated, timely treatment. Patients having hypothyroidism will have increased brain edema. I mean, the brain will increase in size and will cause further increase in intracranial pressure. That means that the blood vessels will be further compressed by the presence of hypothyroidism. And if you don't treat hypothyroidism in these patients, you cannot have the regression of brain edema. You cannot save those lives. Another issue is that exactly for the same reason, because you have partially decreased blood pressure and blood flow to the brain, you may also have decreased production of the hormone that stimulates another gland that is called adrenal gland. And without adrenal hormones, you will have low blood pressure, and the patient will die if you don't replace those hormones. So you have two lethal conditions, which is hypothyroidism and adrenal failure in patients who are in deep coma, for example, as a consequence of severe head trauma. Two conditions that would be lethal if they were isolated and not treated. And they are associated in the same person. So you have two lethal conditions that are left untreated in patients with severe head trauma. And those patients, instead of receiving proper treatment, these patients are submitted to apnea tests, sometimes once or twice, to make sure that they are brain dead. Yes. And by doing this, they are inducing death in patients that could be recovered to normal life. That's very important. We are not talking about recovering to a vegetative state.
Yes,
we are talking about recovering to normal life.
To a normal life.
Yes.
But why don't they change the criteria of brain death when they all know that from 2000 to now? They know that, but why don't they change it?
Yes, we have been asking that question in medical websites, like in the British Medical Journal website. And the answers that we got simply surprises us.
They don't know.
No, they say that they cannot avoid doing apnea test, because if the patients breathes in the operating room, that would be a disaster for the transplant surgeon, because it would be crystal clear that that patient was alive by the time when his organs were taken away. But the reason why they are performing the apnea test is because in no culture all over the world, a patient who is able to breathe can be considered dead. So they say that they have to test those patients for their ability to breathe, because taking them to the operating room.
What is the conclusion with the Apnoetest? What shall doctors do now?
Well, the worst thing about that is that most doctors don't know about what we are discussing here. So that's why it's so important for you to take these discussions to the general public, because then medical doctors will have to to be updated about the physiological issues related to coma. They would understand that by inducing apnea test for up to 10 minutes, they are killing patients in order to make sure that they are dead. And they don't know that because they are taught that this is the legal procedure to be done. Yes. We have told those things to those who support the transplantation system, and we got no answers. We simply got no answers. Once, in an international meeting, a neurologist told me that there is no problem about performing apnea test because he said he knew in advance that the patient was already dead. But this is nonsense, because the test is a diagnostic test. How can he have the diagnosis in advance if he is about to perform the test to diagnose brain death? But that's the only answer that I got. It induces that. Induces that. I repeat what I said before. By performing the apnea test, we are killing patients in order to make sure that they are dead. The apnea test is performed without the consent of the family. And we know that some of those patients, this is being published in the medical literature, we know that some of those patients may have cardiac arrest irreversible cardiac arrest during the test. Because the test is so aggressive to them, to the heart function. But when you do that test on a patient for the diagnosis of brain death, you are not anticipating any benefit to that patient. He had only the risks of the tests. He will not have any benefit from that test. And that's why all those diagnostic tests, including especially the apnea tests, are unethical. There is no possible benefit for the patient. And he is being denied proper, updated, timely treatment. If you want to perform a test on your relative, which is defenseless because he is in coma, so you have to give permission to that. And if you have to give permission to that, you have to be informed about the risks and the benefits. And then the doctor will have to tell you honestly that there is no benefit and there is a lot of risks. And you have to sign it that you accept that. If you do that, if you are properly informed, you would not sign, because there is no benefit, and you now know that your relative is not receiving proper treatment.